There is a technique that surgeons use before difficult operations, that fighter pilots use before high-stakes maneuvers, and that emergency room physicians use between critical cases. It takes less than 5 minutes. It requires no equipment. It costs nothing, and it produces a measurable reduction in cortisol, a drop in heart rate, and a shift in the nervous system from activation to recovery that begins within 60 seconds of starting. Most people have heard some version of this advice. Take a deep breath. Breathe slowly. Calm yourself down. And most people have dismissed it as something you say to a person who is upset, not as a genuine physiological intervention with a documented biological mechanism. That dismissal is costing them something real. Because the difference between taking a deep breath as a vague suggestion and using controlled breathing as a biological tool is the difference between hoping it helps and understanding why it works. Once you understand the mechanism, the technique changes. And when the technique changes, the result changes with it. Let's go through what is actually happening. Your nervous system has 2 operating modes. The first is the sympathetic state, what most people know as fight or flight. Heart rate increases, blood pressure rises, breathing becomes faster and shallower, stress hormones including cortisol and adrenaline flood the system, digestion pauses, peripheral vision narrows, the body mobilizes every available resource toward handling an immediate threat. The second is the parasympathetic state, what researchers call rest and digest, though a better description might be recover and repair. Heart rate slows, blood pressure drops, digestion resumes, muscles release tension, the immune system becomes more active, the brain shifts from reactive, threat-focused processing toward broader, more flexible thinking. These 2 states are not equally accessible. The sympathetic system can activate almost instantly, a sudden noise, a threatening email, an unexpected confrontation, and the body can be in full stress response within seconds. The parasympathetic system is slower to activate. It cannot be switched on directly through conscious decision. You cannot simply decide to be calm the way you can decide to move your hand. But there is an indirect pathway, and it runs through a nerve that most people have never heard of. The vagus nerve is the longest nerve in the human body. It runs from the brainstem down through the neck, into the chest where it passes near the heart and lungs, and continues into the abdomen where it connects to the stomach, intestines, liver, and kidneys. The word vagus comes from the Latin for wandering. The nerve earned that name because of how extensively it travels through the body, touching nearly every major organ system before it ends. The vagus nerve is the primary highway of the parasympathetic nervous system. When it is active, the body is in recovery mode. When its activity is low, the sympathetic system dominates. Here is the critical point. The vagus nerve is unusual among the nerves of the body because it can be deliberately stimulated through something you already do thousands of times per day without thinking about it. Breathing. Specifically, and this is the detail that most people miss, the exhale. When you inhale, the diaphragm descends, the chest expands, and the heart has slightly more space. The heart rate increases marginally during inhalation. When you exhale, the diaphragm rises, the chest compresses, and the vagus nerve is stimulated by the change in pressure. Heart rate decreases marginally during exhalation. This relationship between breathing and heart rate is called respiratory sinus arrhythmia, and it is a direct window into vagal activity. The longer and slower the exhale relative to the inhale, the greater the vagal stimulation. The greater the vagal stimulation, the more strongly the parasympathetic system activates. And the more strongly the parasympathetic system activates, the faster cortisol drops, muscle tension releases, and the nervous system begins to shift out of the stress state. This is the mechanism. It is not placebo. It is not suggestion. It is a direct mechanical relationship between exhalation pressure, vagal nerve stimulation, and parasympathetic activation. A 2017 study published in Frontiers in Psychology tested this directly. Participants practiced a breathing pattern of 5 seconds inhale and 5 seconds exhale, equal in and out with the full cycle taking 10 seconds for 5 minutes. Cortisol levels were measured before and after. Heart rate variability, the most reliable non-invasive measure of vagal tone, was tracked throughout. The results were significant. Cortisol dropped measurably within the 5-minute session. Heart rate variability increased, indicating genuine parasympathetic activation rather than simple relaxation. Self-reported stress levels declined in parallel with the physiological measures. 5 minutes, no equipment, no medication. A separate study published in Cell Reports Medicine in 2023 compared 3 different breathing techniques: box breathing, cyclic hyperventilation, and what researchers called the physiological sigh, against mindfulness meditation for their effects on stress and mood across a 1-month period. The physiological sigh produced the largest improvements in mood and the greatest reductions in anxiety of any technique tested, including mindfulness. The physiological sigh is not a complicated technique. It is a double inhale through the nose, a full breath in, then a second smaller inhale on top of it to fully inflate the lungs, followed by a long, slow exhale through the mouth. The extended exhale is the active component. It produces stronger vagal stimulation than a standard single inhale and exhale pattern. This is the technique that anesthesiologists use before procedures where they need to be both highly alert and physiologically calm. It is taught in special operations training. It appears in emergency medicine protocols. It is used by professional athletes before high-pressure moments. Not because it feels calming, because it reliably produces a measurable physiological shift within a very short time window. Understanding why the exhale specifically is the active component changes how most people practice this. The common instruction, take a deep breath, directs attention to the inhale. People breathe in as fully as possible and then exhale quickly to get ready for the next inhale. This produces some benefit but misses the most effective part of the mechanism. The inhale activates the sympathetic system slightly. The exhale activates the parasympathetic system. If both are equal in duration, the effects partially cancel. If the exhale is longer than the inhale, and specifically if the exhale is slow and controlled rather than quick, the net effect is parasympathetic. Research on the optimal ratio suggests that an exhale approximately twice the length of the inhale produces reliable vagal stimulation. An inhale of 4 seconds and an exhale of 8 seconds, or an inhale of 5 seconds and an exhale of 10. The specific numbers are less important than the ratio and the consistency. Box breathing, 4 seconds in, 4 seconds hold, 4 seconds out, 4 seconds hold, is effective and widely used in military and performance contexts. Its value comes partly from the equal duration of inhale and exhale and partly from the breath holds, which build carbon dioxide tolerance and reduce the tendency towards shallow, rapid breathing that maintains sympathetic activation. But for immediate cortisol reduction and rapid parasympathetic shift, the extended exhale without a hold performs comparaison mon pain pari and is simplifying pain pre pour sounds lay were pain simpler to apply in real-time situations, before a difficult conversation, in the middle of a stressful work session, immediately after an alarming event, or as a deliberate transition between tasks. There is a second physiological mechanism at work here that the research has clarified in recent years, and it explains why breathing affects not just stress, but also clarity of thinking. The hippocampus, the brain region central to memory formation, learning, and spatial reasoning, has been shown in research to synchronize its electrical activity with the breathing rhythm. Specifically, neural activity in the hippocampus rises and falls in coordination with the breath cycle, with peak activity occurring during inhalation through the nose. A 2016 study from Northwestern University found that participants performed better on memory tasks when they inhaled through the nose compared to exhaling or breathing through the mouth during the task. The nasal inhalation appeared to directly drive hippocampal activity in a way that mouth breathing did not. This is part of why thinking often feels clearer after controlled breathing. Not just because stress has reduced, but because the breathing rhythm is directly modulating the neural activity of brain regions involved in cognition. The breath is not just a stress management tool, it is a cognitive tool operating through a direct electrophysiological mechanism. Nasal breathing versus mouth breathing matters beyond this specific finding. The nose filters, humidifies, and warms air before it enters the lungs. Nasal breathing produces nitric oxide, a molecule that dilates blood vessels and improves oxygen delivery to tissues. Chronic mouth breathing bypasses all of these functions and is associated with poorer sleep quality, reduced cognitive performance, and increased sympathetic nervous system tone over time. Most people under stress breathe through the mouth and breathe from the chest rather than the diaphragm. Both patterns maintain sympathetic activation, shifting to slow nasal breathing with diaphragmatic engagement, the belly rising on the inhale, not the chest. In thesis, is the foundational correction that makes every other breathing technique more effective. Here is the practical framework based on the research. For immediate stress response, when something has just activated the fight or flight system, and you need to bring the physiology down quickly, the physiological sigh is the fastest available tool. 2 inhales through the nose, as described, followed by a long, slow exhale through the mouth. Repeat 2 to 3 times. The shift begins within the first exhale. For sustained calm during a difficult period, a high-stakes presentation, a difficult conversation, a demanding work session, the extended exhale ratio works well continuously. Inhale for 4 to 5 seconds through the nose, exhale for 8 to 10 seconds through the mouth or nose. This can be maintained while doing other things once it becomes practiced. The continuous parasympathetic stimulation prevents cortisol from accumulating to the level that impairs performance. For a deliberate transition, moving from one task or mental state to another, resetting between meetings, shifting from work to personal time, 5 minutes of box breathing or 5 to 5 breathing creates a measurable hormonal and neurological state change that most people experience as a genuine mental reset. This is the protocol closest to what professional performance contexts use as a formal practice. For sleep onset, a context where many people struggle with an activated mind preventing sleep, slow breathing with an extended exhale of 10 to 12 seconds has been shown to reduce sleep onset time and improve the transition into deeper sleep stages by reducing sympathetic arousal at the point of trying to sleep. None of these require a specific app, a guided audio, a practice space, or any preparation. They require understanding what you are doing and why, which changes the execution from a hopeful attempt to a deliberate physiological intervention. Here is the framing that matters most. Stress management advice usually focuses on what to do about the circumstances that cause stress, or on psychological reframing, or on lifestyle changes that take weeks or months to produce results. Breathing is different. It operates on the nervous system directly through a mechanical pathway, producing measurable physiological change in a time frame measured in seconds to minutes. It does not require the circumstances to change. It does not require a different mindset. It works in the middle of the stressor, not after it. That is what makes it genuinely useful rather than aspirationally useful. You can use it in the moment when everything else is impossible. The surgeon uses it because a precise technique requires steady hands and clear thinking, and cortisol interferes with both. The pilot uses it because high-stakes decisions under pressure require access to deliberate processing rather than reactive processing, and the extended exhale shifts the brain in that direction within seconds. The emergency physician uses it because the cognitive load of a complex case requires full neurological function, and 5 minutes of controlled breathing between cases restores it. These are not people in relaxed environments looking for a wellness practice. They are people in high-demand environments using a physiological tool because the research says it works and the results confirm it. The same tool is available to anyone. The mechanism does not change based on who is using it. Exhale slowly, longer than you inhale, through the nose if possible. Repeat. That is the whole thing. The rest is just understanding why it works, which is why you are more likely to actually do it. If this changed how you think about breathing as something more than a calming suggestion, hit the like button. Share it with someone who is currently managing stress through willpower alone, and subscribe for more content.